ERi-TV, dear viewers, welcome to English News Broadcast. I'm Bersabet Tagle, and these are the major headlines for today. Ambassador Isa Ahmed Isa holds talks with Sudanese leader. Meeting on developing agricultural production in Afib subzone. Overworked U.S. nurses strike over low pay and staffing shortages. And Burkina Faso military leader takes over defense portfolio in cabinet reshuffle. On your local news, Eritrean ambassador to the Republic of Sudan, Mr. Isa Ahmed Isa, met and held talks on 12 September with General Abdel Fattah al-Burhan, chairman of Sudanese Sovereign Council, focusing on strengthening bilateral ties and mutual cooperation. At the meeting, the two sides reviewed the progress of the programs that have been initiated to develop the relations between Eritrea and Sudan. Ambassador Isa Ahmed Isa also reaffirmed that Eritrea will continue the initiative to bring stability in eastern Sudan as well as in strengthening the friendship between peoples of the two countries. General Abdel Fattah al-Burhan, on his part, commended the people and government of Eritrea for standing along the independent choice of people of Sudan in general, and the all-rounded support of President Isaias Afwerki is extending to the Sudanese people. Expressing appreciation for the effort Eritrea is exerting to create peace and stability in the region, General al-Burhan expressed readiness to work for the development of the historical relations between Eritrea and Sudan to the highest level. Proceeding with your news, meeting on developing agricultural production as well as expansion of irrigation farming was organized in Afib subzone. Speaking at the event, Mr. Ahmed Mohammed Noor Rajib, administrator of the subzone, indicating that soil and water conservation is the main component for the development of agricultural activities and boosting agricultural production, called for reinforced participation in forestation programs, renovation of roads, and social service provision institutions. Mr. Saleh Jabir, secretary of the PFDJ in the subzone, called on members to play leading role for strengthening the participation of the public in the implementation of the set-out development programs. The participants of the meeting, on their part, expressed readiness to strengthen participation in the implementation of the development programs and in the addressing the challenges being encountered in the education sector. On today's last report, Nurse Suleiman Hussein, head of Mayad Kamo Health Station, reported that in the health station, equipped with modern facility and manpower, is providing commendable health service to the public. According to Nurse Suleiman, the health station provides pre- and postnatal treatment, laboratory service, children's vaccination, as well as pharmacy service, indicating that the staff of the health station have been conducting sustainable awareness-raising activities with a view to raise the understanding of the public on health-related issues. Nurse Suleiman said that as a result, children's vaccination coverage has increased to 95% and the prevalence of communicable diseases has significantly been reduced. The beneficiaries, on their part, said that the health station established in their backyard is providing praiseworthy health service to the public and especially to children and mothers. Mayad Kamo Health Station, established in 2020 in cooperation with the Ministry of Health and Northern Red Sea Region Administration, is providing health service with 15 health professionals. And now I'll be back with the international news after the short break. Welcome back. Approximately 15,000 private sector nurses in the U.S. state of Minnesota have launched a 3-day strike, one of the largest of its kind in the U.S. history, as they push for higher pay and better staffing in a healthcare system that has been stretched to its limits during the COVID-19 pandemic. The nurses walked off the job starting yesterday in 7 healthcare systems in Minneapolis and Duluth, mounting picket lines, chanting slogans, and holding signs bearing messages such as "Patience before profits." The stoppage was set to last until Thursday morning, according to a spokesperson for the Minnesota Nurses Association, which was coordinating the action and will affect 16 hospitals. The strike highlights the persistent problems that U.S. healthcare workers face, such as low pay and staffing shortages. On today's last report, a statement read yesterday on Burkina Faso's national television said that Burkina Faso's military leader, Colonel Paul Henry Damiba, has taken over the defense portfolio in the Western African nation, struggling with an ongoing Islamist insurgency. The statement did not give reasons for the cabinet reshuffle. Damiba seized power in January, citing the previous government's inability to tackle the country's problems, including the insurgency that has killed thousands and displaced more than 2 million, including in neighboring Mali and Niger. Attacks by militants linked to Islamic State and the Al-Qaeda have in fact continued unabated since the coup. You're still watching us on ERi-TV, dear viewers, and now a recap of today's major headlines. Ambassador Isa Ahmed Isa holds talks with Sudanese leader. Meeting on developing agricultural production in Afib subzone. Overworked U.S. nurses strike over low pay and staffing shortages. And Burkina Faso military leader takes over defense portfolio in cabinet reshuffle. Dear viewers, that was it for today. Thanks for watching and have a good one.